Hello, everybody. Thank you for joining us today. We are having a conversation with two OBGYNs from the Ascension Care Provider Network. We are joined by Dr. Carnahan and Dr. McAvoy. Thank you so much for taking some time out of what I'm sure is your very busy schedule to talk with us a little bit more today. And we are excited to get to know a little bit more about you, as well as some of the services that you provide to your patients in OBGYN.
So as far as my background, I've done most of my training in Wisconsin. I was a Badger in undergrad and then did medical school and residency here in Milwaukee at the medical college. And now, since finishing residency, joined my current practice a little over a year ago, and I'm also a mom in Milwaukee. I got interested in OBGYN because in medical school, I was actually surprised by how much I loved anatomy and thought, okay, well, maybe I should look at a surgical specialty. But I found that a lot of those areas of medicine felt a little dry. And what I really liked about OBGYN is I think it has a really strong human component. So everything that we discuss in our specialty is not just important medically, but also to the most important components of a woman's life. So starting a family, trying to conceive, trying to prevent pregnancy, all of these things, affect pretty much the most important aspects of their lives. And that's true really of even the most basic visits. So it's a really rewarding area and very meaningful work. Everybody's situation, everybody's values are totally different. And everyone's kind of medical situation is different. So I really enjoy putting those pieces together and giving someone the information that they need and support that they need to make a decision that makes sense for them.
It's like a personalized puzzle that you're trying to
putting together the puzzle for patients. So
thank you. Dr. McAvoy, how about you?
So I'm a father of 5 mostly wonderful children from Waukesha originally. I like to call myself Milwaukee Dad, but I guess Milwaukee Mom was already taken. But I love Milwaukee. I love just the small town feel. I love when I see babies that I've delivered now playing against my kids in sports. I love delivering babies on my birthday. I think it's a wonderful way to share that special day and kind of creates memories. So these are all kinds of things that just are awesome about my job, kind of my chosen profession, but then also kind of the Milwaukee area. So it's kind of special that way.
Yeah.
As far as kind of why OBGYN, on our side, definitely the preventive visit, the annual exam. That's really where we get you. It can find so many different things that just brings you to a better overall place of health. So that's one of the things, just absolutely kind of a broken record. You guys hear it all the time, but absolutely get those annual wellness visits in. Now's a great time to kind of plan on doing so, especially with the new year starting. So, so with most of the issues that we encounter, there are actually quite a few different options as far as what the treatment is, that sort of thing. And there are differences as far as what the right thing is for, the patient that's right there with me. And so one of the things that we like to do is look at that spectrum of options and really kind of have a discussion about, here's an option. Is it the right thing for you? Maybe let's kind of figure that out. But really stay as kind of minimally invasive, least invasive as possible. But then sometimes it is surgery. And so if surgery is needed, we like to keep that as minimally invasive as possible too. So if there's some issue where something like a hysterectomy is needed, if we can avoid cuts altogether, wonderful. Otherwise, if it's the right thing, we can do robotic or laparoscopic surgery just to avoid that longer recovery, more pain afterwards. So lots of different options. Staying minimally invasive is always a good thing.
That's really wild when I wrap my head around the concept of robotic surgery. It's one of those things that sounds suspiciously made up, but it's not.
It sounds like so many people think it's all right, we're in the room, we hook up the robot, we just go sit.
Yeah, you're sipping your latte in the corner.
Yeah, it's a little bit like that, but it is. I mean, and I've said it from the beginning. It's kind of like you're playing a video game. Mm-hmm. It's a lot like a video game, too much like a video game. But
that's
you need to be a little more careful. It's awesome. I mean, it truly is just so much fun, and kind of you feel vindicated for all the years growing up when you were told, why are you playing those video games? You're never going to amount to anything because of those video games. I say the same thing to my children now, and who knows, maybe it'll be worth something for them too. But
I was just thinking that, like, I can't even come down to my kid now for like playing too many video games because he could be training to be a surgeon.
Absolutely.
No, I didn't play that many video games, and I like the robot too.
Yeah.
Speaking of those wellness visits, so we're all used to, you know, or at least we're familiar with that at those visits, they usually have that breast exams for checking for like breast cancer screening. We're used to that pap smear, like, but I'm not gonna lie, sometimes they're like, what else is actually happening? What else is going on during those wellness checks? Like, what are the components of that pelvic exam? What are you looking for? And what are those, why is that so important to do annually?
Annual checkups are really important. And, you know, most of our patients are young and healthy women. So a lot of the times they'll joke with me about, you know, do I really have to come here every year? Like, is this that important? And are sometimes surprised that I almost always find something that's important for us to address during an annual check-in. I always start my annual exams going through patients' medical history, their surgery history, really importantly, their family history, and then social history, which includes like drinking, alcohol, smoking, drug use, all of that stuff. And so that really offers an opportunity to find ways to identify certain risk factors in a woman's life that might affect her reproductive health. So that could be, you know, if a woman is considering getting pregnant in the future, is already pregnant, and needs to have a healthy pregnancy. It might mean identifying areas where we need to do like very careful cancer surveillance that we wouldn't have otherwise thought, just looking at her, you know, and saying, oh, she's young and healthy. So that's kind of where we start. And then the physical exam is kind of the second half. So we call it like a history and physical. So during the physical exam, we always do like the breast and the pap smear, which people are usually familiar with. But, you know, when we do a full pelvic exam, we evaluate, you know, the external genitalia and, you know, that we can look at the cervix, even though we don't always necessarily do a pap smear because we have really good evidence now that we can space those out safely. Which is great, but you know, having an annual check every year is still really important because if we ever identified something abnormal, we would have the opportunity to look into it further. And then lastly, as part of the pelvic exam, a gynecologist will almost always do something called a bimanual exam, which is where you can actually feel the uterus and the ovaries, which I think a lot of women are surprised to learn that, yeah, you can actually feel those organs in your pelvis. But we can identify, you know, if there's pelvic pain, what we think might be causing it and get a pretty good idea of that right then and there. And also feel, are there any abnormal masses? Is the uterus larger than it should be? All of that kind of thing.
So that's when like with the prodding on the belly, when you're like pushing around, that's what you're feeling for?
Yeah, exactly. Yeah.
Oh. I always thought that was like, did you eat enough? Or like,
do you really have to go to the bathroom? Let me make sure.
Yeah, exactly. Like, are you trying to make me pee my pants right now? What is happening?
Yeah,
I there's a lot that I didn't know that. I'm glad that you mentioned, you used the term cancer surveillance, that, you know, that whole family history thing combined with, you know, things that you're encountering there can really let you know, like, you know, hey, this might not be an issue right now, but that might be something that we have to keep an eye on in the future. I think that's a really good term for that.
There's a lot of information in a family and a personal history that can tell us a lot about what to expect with somebody's health in the future.
I mean, let's be real. It's a sensitive area. It's, you know, a topic that we're not exactly telling everybody about. So, you know, if we're having things like super painful periods, issue with incontinence, challenges conceiving, stuff like that. Like, that's something that absolutely should be getting brought up at that annual exam. And I mean, like, there are interventions and things that can be done from you all to help with that. Can Dr. McAvoy, can you kind of like tell us a little bit more about that?
Sure. And I think you bring up a great point, is that, you know, these aren't things that you always like to talk about with your friends or definitely your family, things along those lines. So when you're in for your annual exam, it's a safe place. So we can kind of help you help yourself, sort of thing, with maybe we help out with this or that. But yeah, I think having that conversation, being very open about this isn't right or this seems to be off, is it normal? Such an important thing. You know, even just being here talking before the exam.
But as you get older, you know, like more things tend to come up as we age, and being able to advocate is a huge part of establishing that relationship with your care provider.
Yeah, absolutely. And I think getting started early, feeling empowered to do so is so important. And that's where even starting out at a young age with just going in, not necessarily for the exam, checking the ovaries. We don't always have to do the pap smear like Dr. Carnahan said. Just even talking through your health is such an important thing. So that's really what the preventive visit is. It's not just the pap smear. And that's what everyone's always thought for years. That's just a little bit of it. It's kind of working on that long-term wellness, and absolutely being your own best advocate really helps get you there.
Well, both of you see patients at the Ascension Clinic on 117th and Burleigh. And for your hospital stuff like delivery, surgery, stuff like that, you're at the St. Joe's campus, correct?
Yes. Which I like to joke, like everyone and their mom in Milwaukee was born at St. Joe's, because like literally everyone and their mom was born at St. Joe's. But so with that reputation as the baby hospital, there's so much experience, whether you're talking about like the labor and delivery nurses or the NICU that supports us and is always there to help us if we are worried about babies. You know, I think those are the things that are like the most important to have as kind of the backbone when you're looking for obstetric care. So our group provides 24/7 coverage, and we have another group that also covers what we call the OB emergency department, which is a newer thing, but it's kind of just building on the idea that we were trying to make, I think, emergency or urgent care for women related to pregnancy issues more accessible. And so far that's worked really nicely. So we have, you know, 2 of us in-house in the hospital 24/7.
Well, thank you very much. I think the biggest, you know, the biggest points that we want to emphasize are absolutely the importance of that annual pelvic exam and using that as an opportunity to really maintain your overall health and wellness, establishing that relationship with your care provider, that sense of communication and trust, and that pelvic exam, it's about more than just the pap smear. It's about more than just that, and that can be such a huge part of comprehensive, compassionate care. And you both are currently accepting new patients. Is that correct?
Mm-hmm. Absolutely.
Awesome. So if you head to the link that you'll see down at the ticker here at the bottom of this video, or at either of the links provided with this video, you'll see if you go to ascension.com/MKEmom, you will be able to get in touch with both of these providers if you would like to schedule an appointment and learn more about them.